Today we are going to discuss the common instruments used in the outpatient department of otolaryngology. This is the first instrument I am going to show you, known as the tongue depressor. The common terms is known as tongue depressor. We use the term lax tongue depressor just to honor the person who has devised this instrument. So this tongue depressor is used to slowly depress the tongue to examine the oral cavity and the throat. So this tongue depressor is ideally held in the non-dominant hand so that the dominant hand will be free to do the manipulations or instrumentation which may be needed. So you use the hold the tongue depressor like this and then gently depress the tongue. You should not ask the patient to protrude the tongue. You just ask the patient to depress the tongue. So you just depress the tongue, the oral cavity will become visible fully, and then towards the handle of the tongue depressor is slightly curved. This curvature, the tip or the curvature can be used to retract the cheek. You can use this to retract the cheek to examine the wisdom tooth area, to examine the parotid drainage area. All these things can be done using this tongue depressor. So the next common instrument which is found in the OPD set of a ENT OP happens to be this one. This is actually a Tilly's forceps. This is a Tilly's forceps, otherwise known as Tilly's nasal forceps. As the name suggests, this forceps is used to hack the nasal cavity with a medicated gauze. The medication can be 4% xylocaine. You can use it to remove some of the foreign bodies if you are comfortable with it. If you reach it, if you are able to remove it, you can attempt removal of the foreign body inside the nasal cavity using this Tilly's nasal speculum. So you just this curvature, watch this curvature of the nasal speculum. This curvature really helps you to visualize the tip of the nasal forceps inside the nasal cavity. So when you pass the tip of the nasal when you pass this forceps into the nasal cavity, the tip will always be visible to you. So the curvature ensures the visibility of the tip always. The next instrument I'm going to show you is a Hartmann's forceps, Hartmann's oral forceps. So this is more or less designed like a crocodile jaw, and then there are serrations here. The serrations ensure that cotton ball can be held by this forceps without the fear of any slippage. So you can pack the ear with a cotton ball using this forceps. You can use the same forceps to pack the nasal cavity, remove foreign body inside the nasal cavity. But I personally would use this instrument only for putting cotton ball or inserting cotton ball inside the oral cavity. The next instrument I'm going to show you is a 150-year-old instrument. It's actually a Thudicum's nasal speculum. This speculum is ideally held in a non-dominant hand. This has two vertical limbs and two horizontal limbs, and then these limbs are joined by a curved shoulder. So you hold the speculum like this by hooking the index finger over the shoulder, stabilizing the left arm or left limb of the Thudicum speculum by your ring finger, and then using the middle finger to compress. This is how you operate. This is how you hold the Thudicum nasal speculum and use it to retract the alar and to examine the nasal cavity completely. The next instrument I am going to show you is Garcia's indirect laryngoscopic mirror. So this is detachable. You can remove the handle from the mirror, and this mirror comes in 3 or 4 sizes. So depending on the size of the patient's throat, you can choose that mirror. So this mirror can be held in your dominant hand and then use a tongue depressor, or you can ask the patient to protrude out the tongue, hold the tongue between gauze, and then gently slide this mirror into the posterior, just behind the posterior third of the tongue. Slowly you will be able to visualize the laryngeal inlet and the vocal cord. This instrument is named after Garcia. Garcia is actually the person who conceived this mirror. He is actually not a medical person or a scientist. He was a singer by profession. So when he went to a barber shop to have his hair dressing done, as you all know, the barber shop will be surrounded by a set of mirrors. Multiple mirrors will be seen around the barber shop. So he was able to see his vocal cord moving in one of these mirrors. So then he realized that mirrors can be used to visualize vocal cord, and this same concept is used by otolaryngologists to visualize the vocal cords. So you use this laryngeal mirror in your dominant hand to visualize the laryngeal inlet and the mobility of the vocal cord. The next instrument I am going to show you is the postnasal mirror. Postnasal mirror, the curvature itself will tell you that you will be able to slide this mirror under the uvula. You use the lax tongue depressor to depress the tongue, slide the postnasal mirror under the uvula of the tongue to visualize the nasopharynx. The main problem with these mirrors happens to be they have a tendency to get fogged. So when you are examining, fogging is also likely to occur. So how can you prevent fogging from occurring? So you need to warm the mirror. So how you can warm the mirror? You can use a spirit lamp and you can use a warm water to warm this mirror. If you are using a spirit lamp, you ensure that you warm the metal surface of the mirror. Don't heat the glass portion of the mirror because sorry, you should warm only the glass portion of the mirror, not the metal portion, because the uh, coefficient of expansion of the metal is faster or larger than that of the glass. So if you are going to warm the metal portion of the laryngeal mirror, the glass will fall off. So you ensure that you warm the glass portion of the mirror by heating the mirror with the spirit lamp, by showing the mirror side of the laryngeal mirror to the spirit lamp, so that the mirror won't fall off. If you are going to heat the metal side, you remember, again I repeat because of the previous confusion, I'm just reiterating again, you should warm the mirror by warming the or heating the mirror surface, not the metal surface. If you are going to heat the metal surface, the metal will expand faster and the mirror will fall off into your lap. So always ensure that you use a spirit lamp or use warm water. If you are using a warm water, the entire mirror as well as the metal portion will be warmed together, so there is no threat of mirror falling down. Or you can carry your butane cigarette lighter. So as I have been telling you, it is always imperative to warm the mirror surface rather than the metal surface. Next instrument I am going to show you is the wax hook or ear vectus, and this is actually resembles a scoop. You can use this scoop to scoop out the wax from the external auditory canal. The same instrument again can be used to remove foreign bodies from the nasal cavity. I reiterate again, this instrument can be used to remove wax or foreign body from the ear. Similarly, the same instrument can also be used to remove foreign body from the nose. The next instrument I am going to show you is the Higginson syringe. This syringe, sorry, I've lost the nozzle. It will have a nozzle here. So the capacity of the syringe is around 120 ml or 4 fluid ounce. You just load this syringe with water at body temperature. It should neither be too high or too low. If it is going to be too high or too low, it will stimulate the lateral semicircular canal, causing giddiness to the patient. The nozzle of the syringe should be directed towards the roof of the external aortic canal. You should gently squeeze the piston like this. You should hold it in your dominant hand, squeeze the piston like this. The water will gently flow, hit the roof of the external aortic canal, then flow touching the eardrum, and then flow posterior wall and the floor of the external aortic canal, flow into the kidney tray held underneath the ear, thereby ensuring or flushing out the wax or foreign bodies. Non-hygroscopic foreign bodies, if any present in the ear, can also be removed by syringing. Syringing is actually a versatile OP instrument, and syringing really helps us to do away with the foreign body or wax inside the ear cavity. The next instrument I am going to show you is a Thudicum's nasal speculum. This speculum is literally, the design of this speculum is 150 years old. So this has undergone very little modification. It has two limbs, to vertical and to horizontal, and then it has a shoulder holding the limbs together. You hook the Thudicum speculum by the index finger, stabilize the uh, left limb by your ring finger, and then use your middle finger to compress it. So use it to visualize the nasal cavity proper. So this is how you use the nasal speculum. The next instrument I am going to show you is a Siegel's pneumatic oral speculum. The component of the speculum is, it has a oral speculum. This is used to straighten the external aortic canal, and then it is attached to the eyepiece. The eyepiece contains a convex lens of around about 8 to 10 diopters. This lens ensures you get a 2.5 time magnification of the eardrum, which you visualize. Then it is connected to a bulb. So by pressing the bulb, the pressure at the tip of the oral speculum gets increased. So you insert it into the ear canal. You visualize the eardrum. You get a magnified view of the eardrum to this eyepiece. Then on compressing the bulb, the pressure of the external aortic canal will increase, and then as soon as you release, the pressure of the external aortic canal reduces. Thereby you can see the mobility of the eardrum clearly. So Siegel's pneumatic oral speculum is used to test for the mobility of the eardrum. So the next instrument I'm going to show you is the tuning fork. The tuning fork, you commonly use three frequencies. One is the 256 hertz, the other one is the 512 hertz, the other one is the 1024 hertz. And this tuning fork has two limbs, and then it is joined here, and then it has a base. This is where you hold. It has a nice uh, grooves to ensure that it doesn't slip out of your hand. You use your thumb to hold like this. Ideally speaking, you should strike the tuning fork at the junction of the upper third and the lower two-third. So that is the maximum vibrating portion of the tuning fork. So you hit it against the elbow, you strike at the junction of the upper third and the lower two-third, and you use the vibrating fork to perform a Rayleigh's test, Weber's test, and absolute bone conduction test. So there are certain prerequisites which are necessary to ensure that the tuning fork is a good one. So the following prerequisite should be met. It should be made of a good alloy. It should vibrate at the set frequency. It should maintain the vibration for 1 full minute, and it should not produce any overtones. So these are all the prerequisites for a ideal tuning fork. The next is the otoscope. So this is a commonly used OP instrument to examine the eardrum of a patient. You hold the otoscope as you will wield your pen. So this is the speculum, and it has a eyepiece. So you use the view the eardrum using the eyepiece. There is illumination there. So when you switch on, the otoscope will get lightened up. So the light will be at the distal end. So the entire ear canal will be brightly illuminated when you insert the speculum. The speculum plays a very important role. It straightens the external aortic canal, thereby bringing the entire eardrum into vision. And then you can attach a Siegelization bulb to this tuning fork and to this otoscope, and then you just compress the bulb. This serves the same function as a Siegel's pneumatic speculum. So the Siegelization bulb performs a function of the Siegel's pneumatic speculum. You can test for the mobility of the eardrum using otoscope by attaching the Siegelization attachment to the otoscope. The next instrument I am going to show you is the home spray. So this is the home spray, which is actually a relic, historical importance, because right now all the medicated sprays are available as self disposable containers. So right now this is what we were using when we were students. So you pour the medicine into this bottle or jar, and then you attach the bulb here, and then you compress the bulb here. By compressing the bulb, you will be spraying the liquid out of this nozzle. So home spray is used to spray 4% silicone into the throat. It is used to spray you used to spray 4% silicone into the throat to anesthetize the throat. You can use the same spray to anesthetize the nose by spraying the nasal cavity. Another instrument I'm going to show you is a polyester bag. So this bag, this bulb with a nozzle is used to treat eustachian catarrh, eustachian block. This is very useful in pediatric patients. You just put it in the nasal cavity of the individual. Ask the patient to say KKK. When the patient is saying KKK, you just push the bulb, press the bulb. So it will pump air into the nasal cavity, and from the nasal cavity via the eustachian tube, the air will get into the middle ear cavity. So this Pulitzer bag can be used effectively to ventilate the middle ear cavity. Just have a good look at the Pulitzer bag. So this is how a Pulitzer bag will look like. I think completed the majority of the OP instruments. So one or two instruments I could have missed. So I'll be showing pictures of those instruments. So one or two instruments I could have missed. The next one is a Jobson-Harney probe. This is the Jobson-Harney probe. This is again another commonly used OP instrument where it has a small ring at one of the end. The other one is a serrated tip. So this serrated tip, you can wind cotton over the serrated tip. Then you can use it as a cotton applicator. The same probe can be used as a wax hook as well as a cotton applicator. The Jobson-Harney probe can be used as a wax hook or a cotton applicator. So one end serves as a wax hook, the other one serves as a cotton applicator. Thank you very much for your patient listening.